Many in the U.S. are grappling with a mental health crisis, rising costs for care, and now the triple-demic. But as the year comes to a close, what's the outlook for these and other healthcare trends for 2023? For that, let's get to Columbia University healthcare policy professor and private equity investor Meghan Fitzgerald. And also joining us for the conversation is our healthcare reporter, Anjali Kamlani. Meg, it's always great to see you. Oh, my gosh, I love the holiday red that you're wearing today. And you also surveyed some executives within the healthcare industry to try and figure out what's going to be happening next year. And sadly, some of the trends are the same as they were this year, including still labor shortages, which is really interesting to me, given what we're seeing writ large in the labor market.
Yeah, correct. I mean, what I learned in the survey is healthcare is traditionally a defensive sector, not tied to the ups and downs of the economy, as you guys report on, a bear market and a pending recession. So it tends to hold up better than others. It doesn't mean it all goes up, but it often declines less. And when I talk to industry insiders, they are still grappling with labor. Either labor exiting the workforce early, retiring, frontline workers being burnt out. In fact, a recent poll showed about 66% of hospitals stated that they either had to delay care or alter care because they did not have staff on the front line to deliver care. So everyone I spoke to, 25% of the survey respondents put labor shortages number one, Julie. It's not going away.
Meg, Anjali here. I wonder, with all of this, how much do you think technology, not just telepresence, but just other apps and the like, that we've seen a push for, do you see the reality of that coming through in 2023 with, higher utilization?
Yeah, so everyone stated that the extension of the telehealth benefits have now really made telehealth telepresent. It's not going away. Everyone is using it. It's lowered cost. It's increased quality. Consumers like it. They were forced to use it during the pandemic, and now they've come to find out they like it. So it doesn't replace, an in-person visit for something that is really acute, like an MI or, even needing surgery, of course, but it does help to triage patients and allow them to see a provider when maybe they would have had to wait a few weeks, especially with the shortage. So this definitely is a positive on the other side of that negative trend.
Meg, one of the things we saw a little bit of in 2022 was some consolidation in the industry, particularly primary care practices being sort of rolled up. Is that a trend that's going to continue? And what does that mean both on the business side and on the patient side?
Yeah, consolidation was the number 2 trend after labor shortages. And the reason why is, Julie, if you think about the titans of the industry, there are only 5 payers who make up 50% of the market. There's 3 distributors that make up 95% of the market. And there's a handful of pharmacies that make up 50% of the market. So where are they going to go to grow? They're likely going to start looking at all of the assets that were overvalued, and people paid a high price for them last year during a really epic year of M&A. So I think there's going to be an opportunity for some of the titans of the industry to go shopping. And I think a likely place to look is going to be digital health, primary care assets, and pharma services.
I wonder about that, Meg. When you're talking about these titans and where they have to move, there's been so much discussion about the vertical integration and what the results have been, the impact on the healthcare economy. On one side, there's still a discussion about trying to reduce costs of care. And to your point, telehealth and digital presence has helped with that. But then you combine that with the labor shortage, and it seems like there's a bit of a flux situation on what exactly this healthcare economy is going to look like in 2023. So aside from those, specifics, what do you see the whole picture looking like?
I think it's going to be pretty positive because I think people tend to flock to healthcare when there is a dislocation or there is a downturn. And I think what we saw this week, and you have done really great reporting on that, is the enormous stimulus bill that was passed this week. A lot of money was allocated towards access, cost, and quality. The dedication not to hurt physicians right now and kind of not hit them too hard with Medicare cuts, I think is showing that we also have a bit of a backstop from the government to say healthcare is really important. It took some people the pandemic to realize how important it was. But I think healthcare looks pretty good for next year. I think I'm going to lean in a little bit to say I'm somewhat bullish on my own industry. I usually always am, but I think more so now than ever.
And Meg, just real quickly here, you just mentioned the pandemic, but it's not anywhere in those trends in healthcare, right? COVID, pandemic not mentioned. Are there any sort of reverberations of the pandemic that are really informing any of these trends?
Yeah, it's interesting. I thought for sure, especially given the flu season, no one wanted to put the pandemic. Maybe they didn't want to, Julie. Maybe they're just tired and they didn't want to say it. But the pandemic kind of bleeds through all of this, right? The questions you both are asking me, whether it's shortages, the move to digital health, alternative sites of care are really growing. We're doing more acute procedures outside the hospital. So any assets that have, looked to have surgery centers, urgent care centers, all of that is growing. So maybe you don't pick the pandemic as a trend, but I think the pandemic has forever changed healthcare, and it certainly is considered in everything that we do and every M&A transaction that people partake in. I think the pandemic has forever left them differently and made them, different deal makers. It's forever going to change the landscape of healthcare. It's hard to ignore that.
Yeah, that makes sense, certainly. Meghan Fitzgerald, always good to catch up with you. Happy holidays. Thank you for being here. Columbia University Healthcare and Policy Professor Meghan Fitzgerald, and she's a private equity investor too. And our Anjali Kimlani. Thank you, Meg.